Hi, I'm Dr. Adrian Cole. I've been working in health and wellness for over a decade now, and in that time, I've sat with thousands of patients. I've seen recoveries that felt like miracles, and I've been there with families during some of their hardest moments. All of those years, all of those conversations have taught me something that most doctors never say out loud. Sometimes, the wisest medical decision is knowing when to simply do nothing. Today, I want to share something very personal with you. Something that goes against what most people believe. And honestly, it might surprise you. I'm going to tell you about the 5 routine medical tests that I personally, after the age of 70, would never get. Not out of laziness, not out of fear, but because of decades of evidence. Because I've seen what happens when medicine becomes obsessed with finding something, anything, and ends up doing more harm than good. These tests are marketed as the gold standard of prevention, but they can pull you into a spiral of anxiety, invasive procedures, and complications that rob you of the very things you value most in your golden years. Your independence, your quality of life. So if you're over 70, or if your parents or grandparents are around that age, please stay with me. I won't just tell you which tests to think twice about. I'll explain why, with real patient stories, and with science that leaves very little room for doubt. And most importantly, I'll give you the smarter, safer, and often simpler alternatives for protecting your health, living longer, and living better. This isn't about being afraid of doctors. It's about being an informed patient who takes the wheel. Let's begin. The first test on my list is probably the most tempting of all, the full body scan. You've seen the ads, maybe at a wellness clinic near you, promising a head-to-toe look inside your body using the latest MRI or CT technology. It sounds amazing, right? A complete picture of everything going on inside you, catching anything before it becomes a problem. It feels like total control. But the reality, friends, is very different. And it can be dangerous. Let me tell you about Robert. A patient of mine, 74 years old, a man full of life. He played golf on weekends, traveled with his wife, spent time with his grandchildren in Florida. He was healthy, not a single symptom. One day, his son, with the best intentions in the world, gave him a full body scan as a birthday gift. Robert went mostly just to make his son happy. And that is exactly where the trouble started. The scan report came back with a note that stopped him cold. A small, indeterminate lesion, 1.5 centimeters, was found on the left kidney. Indeterminate lesion, 2 words that work like a bomb. Overnight, Robert went from being a healthy man to being a patient with something on his kidney. His doctor, following protocol, sent him to a urologist. The urologist, to be thorough, recommended a biopsy. A kidney biopsy is no small thing. It involves inserting a long needle through the back, all the way to the kidney. There are real risks. Bleeding, infection, pain. Robert, being brave, agreed. The results took a week. A week that he and his entire family spent in a state of pure panic. And the final verdict? An angiomyolipoma, a benign tumor, completely harmless, made of fat, muscle, and blood vessels. Something that would never have caused him a single problem in his life. Robert gained nothing. Instead, he lost his peace of mind, went through an invasive and risky procedure, and put his family through tremendous suffering. His story is not the exception. Sadly, it is the rule. And here is the number that changes everything. Studies show that in up to 86% of healthy older adults who get a full body scan, something is found. 86%. The vast majority of those findings, just like Robert's, are what we call incidentalomas, accidental discoveries. Benign, meaningless, spots on the liver, cysts on the kidneys, nodules in the lungs, scars from time that have been sitting quietly for years and will never become a problem. The real problem is that once something is found, what we call the cascade of intervention begins. The finding creates anxiety. Anxiety leads to more tests. More tests can be invasive and carry their own risks. And it can all end in treatments or surgeries that were completely unnecessary. This snowball starts with one test that should never have been done. And if the scan uses CT technology, you are also being exposed to a significant dose of radiation, equivalent to hundreds of chest X-rays. Radiation accumulates. And while the risk from a single scan is low, it is not zero. Why take that risk with no clear benefit? So what is the smarter alternative? The answer is not a machine. It is something far more human. A comprehensive geriatric evaluation. This is not a simple checkup. It is an in-depth conversation with a doctor who understands how aging actually works. Instead of hunting for ghosts, we focus on what truly matters for quality of life. Function. In this kind of evaluation, we first do a frailty check, not as an insult, as a vital medical concept. We measure simple things like walking speed and grip strength. These markers predict future health far better than any image ever could. If we catch early signs of frailty, we can act with exercise and nutrition to reverse it. Then, and this is critical, we do a thorough medication review. It is incredibly common to see older adults taking 10 or more prescriptions from different specialists. Many times, symptoms like dizziness or confusion are not a new disease. They are a side effect of one of those pills. Cleaning up that list can work miracles. And finally, we look at lifestyle habits. Diet, sleep, physical activity, social connection. These are the true pillars of prevention. An anti-inflammatory diet and regular exercise prevent more disease than any scan ever could. This kind of evaluation does not create anxiety. It gives you power. It does not hunt for theoretical problems. It optimizes your real, everyday health. So the next time you see an ad promising to map everything inside you, think of Robert and choose the wisdom of an evaluation that focuses on the person, not the image. The second test I personally avoid is a routine brain MRI for mild forgetfulness. I see this constantly. A patient in their mid to late 70s comes in, often brought by their adult children, because they forgot an actor's name or couldn't remember why they walked into a room. Normal age-related forgetfulness. They're not getting lost. They're not losing track of money. They're managing their daily lives just fine. But the fear of Alzheimer's is so powerful that the family pushes hard for an MRI to see what's happening inside. I want you to understand something clearly. Ordering an MRI in this situation is almost always a terrible idea. It opens a box that only releases anxiety. Let me introduce you to Martha, 78 years old, a sharp and brilliant woman from Ohio, a devoted reader, who started noticing that she sometimes struggled to find exactly the right word. Her daughter, deeply worried, convinced her to get an MRI. The day they read the report, Martha's world fell apart. The radiologist described mild diffuse cortical atrophy appropriate for age and scattered white matter foci of gliosis. For a doctor, that report is basically a description of a normal 78-year-old brain. It is like saying a person of that age has wrinkles or gray hair. The atrophy is a small, expected reduction in brain volume over time. The white matter changes are like tiny scars that form, often from blood pressure that has been slightly elevated over decades. These are expected findings. But for Martha and her daughter, it sounded like a death sentence. Brain atrophy, lesions. They left that office convinced Alzheimer's was right around the corner. From that day, Martha changed. She began doubting herself constantly. She quit her beloved book club out of fear of forgetting a name. The MRI did not give her a diagnosis. It stole her confidence in her own mind. And here is the stunning truth. In studies done on adults over 75 who were completely healthy, 94% of brain MRIs showed abnormal results. Nearly all of them. If you scan 100 perfectly healthy people of that age, 94 will walk out with a report that can plant seeds of panic. The problem is that those images do not reliably reflect how a person actually thinks or functions. I have seen patients with MRIs that looked like a battlefield who were sharp as a tack. And the reverse as well. The image is not the person. And what makes it worse? The MRI result does not change the treatment plan for mild forgetfulness at all. There is no pill that reverses normal age-related brain changes. So what is the sensible alternative? The most valuable tool is a simple 10-minute cognitive test right in the office. Tests like the MiniCog or the MoCA. We ask the patient to remember 3 words and draw a clock. It is simple, fast, and gives us incredibly useful functional information. If the test comes back normal, we can reassure the family with a very high level of confidence. If it shows some difficulty, we do not stop there. We work through what I call the house of false culprits for memory problems. Before even thinking about Alzheimer's, we rule out a list of common and very reversible causes. Medication review comes first, always the top suspect. Sleep aids, anti-anxiety medications, certain antihistamines can all cause mental fog. Then blood work. We check vitamin B12 and thyroid function. A deficiency or hypothyroidism are classic and easily fixable causes. We also evaluate mood. Depression in older adults often shows up as apathy and memory lapses. Treating it can restore mental clarity. And we look at sleep quality. Sleep apnea, which cuts oxygen to the brain at night, is a greatly underestimated cause of cognitive problems. Only after ruling all of this out, if functional tests show a progressive decline, would imaging make sense as part of a full evaluation. The message is simple. For mild forgetfulness, don't rush to a scanner. Find a doctor who will sit down with you, assess your actual function, and look for reversible causes. The third test on my list is the routine cardiac stress test. Putting a person over 70 who feels perfectly well, no chest pain, no shortness of breath, on a treadmill simply because of their age. This practice, while very common, is riddled with problems and can genuinely be dangerous. James's story makes this crystal clear. 72 years old, active, played tennis twice a week, walked every morning in his neighborhood in Georgia. Zero cardiac symptoms. He was about to have hernia surgery, and the hospital protocol required a stress test for everyone over 70. James didn't understand it at all. If he could play 2 hours of tennis, why did he need to run on a treadmill? But protocol is protocol. During the test, James began feeling pressure in his chest. The EKG showed uncertain changes. The cardiologist stopped the test and, with a questionable positive result, recommended the next step: a cardiac catheterization. A catheterization is invasive. A tube is inserted through an artery and guided all the way to the heart to examine the coronary arteries. James, who walked in for a simple test, was now being wheeled to a cardiac procedure. The result? His arteries showed some plaque buildup, perfectly normal for his age. 30 to 40% blockages that required neither a stent nor surgery. What happened? James had a false positive. Treadmill stress tests have a very high false positive rate in older adults. They can produce an abnormal result for 1,000 reasons that have nothing to do with a dangerous blockage. But the damage was already done. James was now labeled as a cardiac patient. He was put on a handful of medications. And worst of all, he became afraid of physical effort. He quit tennis. The test that was supposed to protect him stole his quality of life. And that is without mentioning that the test itself can, in rare cases, trigger an arrhythmia or even a heart attack. So what is the logical alternative? First, and most important, listen to your body. The best stress test is daily life. If you can climb 2 flights of stairs or walk at a good pace without chest pain, you're already passing a stress test every single day. It is crucial to learn to recognize the real warning signs: chest pain with exertion, disproportionate shortness of breath, dizziness. If any of these appear, see a doctor immediately. That is when a test is genuinely indicated. Now, if you want to assess future risk, there is a far more modern and safer tool: the coronary calcium score. It is a simple, low-radiation CT scan, no needles, takes about 5 minutes. It measures the amount of hardened cholesterol in the walls of your arteries. The result is a single number. A 0 means an extremely low risk of heart attack over the coming years. A high number tells us it is time to get serious about prevention. The calcium score tells us our risk level, not whether an artery is blocked. It is a tool to guide prevention, not to trigger invasive procedures. My advice: do not let anyone put you on a treadmill just in case. Trust your body. And if you want a sharper look at your heart risk, ask your doctor about the coronary calcium score. Now we come to the fourth test, and this one might be the most controversial, because a colonoscopy is a fantastic tool, but its value depends entirely on age. The test I am cautious about is the routine colonoscopy after age 75 or 80, for someone whose previous screenings were normal and who has no special risk factors. Let me be clear, I am not against colonoscopies. I recommend them without hesitation starting at age 45 or 50. They prevent colon cancer by allowing us to remove polyps before they turn dangerous. The problem arises when we apply this same logic to people in their late 70s and 80s. In medicine, we must always weigh benefit against risk. And in an 80-year-old, that balance tips toward risk. Let me tell you about Eleanor, 79 years old, living independently in her home in Tennessee. Her last colonoscopy at age 70 was completely normal. Her doctor's computer system sent an automatic reminder that she was due for another one. Eleanor had no symptoms, but she was obedient. The preparation was a nightmare. Liters of laxative that kept her in the bathroom all night. leaving her exhausted and dehydrated. For someone her age, that alone is already a risk. Then there is the sedation, which in older adults carries a higher risk of confusion and respiratory issues. But the complication that keeps doctors up at night is intestinal perforation. As we age, the wall of the colon becomes thinner. The risk of a tear from the scope, while low, 1 or 2 per thousand cases, doubles or triples in people over 75. And a perforation is an emergency requiring major surgery, often with a colostomy bag. For an 80-year-old, a surgery like that can be the end of their independence. Now, what is the benefit? Preventing a cancer that, if it even appeared, would take 5 to 10 years to become a problem. The leading medical guidelines already recommend stopping routine colonoscopy screening between ages 75 and 85. The logic is straightforward. For someone with a life expectancy under 10 years, the colonoscopy is more likely to cause harm than to save them from a future cancer. Of course, this is not a one-size-fits-all rule. Family history, prior polyps, other risk factors, these change the calculation entirely. But for the average person, continuing routine colonoscopies past that age is an unnecessary risk. So what do we do instead? We shift from invasive screening to intelligent monitoring. Watch for symptoms. This is vital. You should see a doctor right away if you notice a persistent change in your bowel habits, blood in the stool, unexplained abdominal pain, unexplained weight loss, or new anemia. At that point, age does not matter and a colonoscopy is absolutely justified. And secondly, the most powerful tool of all, active prevention through diet. The secret to a healthy colon is fiber, fruits, vegetables, legumes, whole grains. Fiber feeds the good bacteria in your gut that produce anti-inflammatory and cancer-fighting substances. Eating more lentils, broccoli, oats, and apples is an intervention far safer than any scope and one that benefits your entire body. My message is this: get your colonoscopies at the right time and at the right age. Up to age 75, they are genuinely important. After that, for most people, it is time to focus on watching for symptoms and trusting the power of what you put on your plate. And now we arrive at the fifth and final test. This one is for the man, and it is one of the most debated topics in all of medicine. The PSA blood test, used to screen for prostate cancer, especially in men over 75. PSA was sold as the great promise for catching prostate cancer early. The problem is that the biology of this cancer, especially in older men, is extremely unpredictable. And the widespread use of PSA has created an epidemic of overdiagnosis and overtreatment. Let me tell you about Charles. 80 years old, widower, independent, active, living his best life in Arizona. At his annual checkup, a routine PSA was ordered. It came back at 6.5, slightly elevated. Charles felt perfectly fine, but that number was the starting gun for the cascade. From his family doctor to a urologist, from the urologist to a prostate biopsy. A prostate biopsy is uncomfortable and carries real risks, especially serious infection, sepsis. Charles was unlucky. He ended up in the hospital with sepsis. He recovered, but then the biopsy result came in. Prostate adenocarcinoma, Gleason 6. Cancer had been found. But what kind of cancer? A Gleason 6 is the most slow-moving type of prostate cancer that exists. It is so slow that many of us in medicine debate whether it should even be called cancer. The likelihood of an 80-year-old man dying from a Gleason 6 is nearly zero. He will almost certainly die with it, not from it. In fact, autopsies show that up to 80% of men in their 80s have microscopic foci of prostate cancer that never affected them in the slightest. But Charles had been told he had cancer. And when people hear that word, they want it removed. Even though active surveillance, monitoring without treating, was offered to him, anxiety won. He chose radiation therapy. The treatment was technically successful, but the price was devastating. The radiation caused permanent urinary incontinence and erectile dysfunction. His social life collapsed. We cured a cancer that would never have killed him, but in doing so, we destroyed his quality of life. This is the perfect example of overdiagnosis, finding a cancer that would never have caused harm, and overtreatment, aggressive therapy for a harmless disease. And PSA drives the entire cycle. PSA can rise for 1,000 reasons. Inflammation, infection, even riding a bike. For every man who is genuinely helped by PSA screening, an estimated 50 others are diagnosed and treated unnecessarily, with permanent consequences. So what do? Do we throw the PSA test away entirely? No, we do something far more intelligent. We replace automatic testing with a shared, informed conversation. The doctor needs to have an honest discussion with the patient, laying out the real numbers, the pros and the cons. And then the patient decides what matters more to him. The remote chance of extending life slightly in exchange for a very real risk of damaging his quality of life permanently. For those diagnosed with low-risk cancer, the alternative to treatment is active surveillance. It is not doing nothing. It is careful, structured monitoring to make sure the tumor does not become aggressive. And of course, we focus on real symptoms. Difficulty urinating, blood, bone pain. Those require investigation at any age. And there you have them. The 5 tests that, based on everything I have seen and learned, I personally would not get past the age of 70. The full body scan, a factory of anxiety. The routine brain MRI for mild forgetfulness, labeling you as abnormal for no good reason. The routine cardiac stress test, with more risk than benefit. The colonoscopy screening past 75, where the scales tip toward danger. And the routine PSA in older men, the king of overdiagnosis. Do you see the common thread here? This is a call for wiser medicine, more personalized medicine, more human medicine, medicine that understands that especially in our later years, the goal is not only to live longer, it is to live better, with quality, with independence, with joy. True prevention is not a battery of tests hunting for ghosts. It is a partnership with your doctor, an evaluation centered on how you actually function, and a daily commitment to a healthy way of living. My goal is not for you to be afraid of medicine. It is the opposite. I want you to become the author of your own health. Ask questions, understand the reason behind every test, and be bold enough to say, "Doctor, do I really need this at my age, in my situation?" Your health is not a report without abnormalities. Your health is being able to play with your grandchildren, enjoy a walk on a sunny afternoon, keep your mind sharp and your spirit alive. And sometimes the bravest and healthiest decision you can make is to say no to an unnecessary test. If this message was helpful to you, if it might help someone you love, please share this video. And to stay connected with more experience-based advice for a long and full life, subscribe to this channel and hit the notification bell. I would love to hear from you. Leave me a comment below. Have you ever felt pressured to get a test that didn't feel right to you? I will read every single one. Thank you so much for being here. Take care of yourselves. And above all, take care of yourselves with wisdom.